Hey everybody, welcome to another episode of The Bitter Pill. So, before I get started today, I just wanted to uh, thank Charles Anderson of the Lone Wolf podcast for having me on recently to discuss vaccines and COVID. We had a bit of an argument about these issues on Twitter a few weeks ago, and he invited me on to discuss things in more depth. And I thought we really had a great discussion. We didn't see eye to eye on everything, and we don't agree on vaccine mandates, for example, but we agreed on a lot. And I really appreciated the open minded and objective manner in which he engaged in the dialogue. So thanks again for that, Charles. So today I want to talk about a subject that I've sort of put off talking about because you know, it, to be honest, it's been really painful for me to see how much of the American left has gotten sucked into this, if not anti-vax, at least anti-vaccination mandate rabbit hole, where there's this extreme libertarian ideology that individuals' rights to do whatever they want in whatever circumstance they want, um, at least when it comes to vaccines, being able to say you refuse to get a vaccine even if you are, uh, a nursing home worker taking care of uh, perhaps immunologically vulnerable elderly people. Um, I don't think you should have the right to do that. I don't think individual liberty should go that far. And much of the American left, at least, given the hyper individualistic society in which we live, does believe that. And conversely, tend to downplay, uh, unfortunately, the severity of the pandemic that we're in the middle of, where despite a little over half of the U.S. population being vaccinated, we just had 1,700 people die yesterday. Almost 750,000 dead from COVID already. Tens of millions of Americans have gotten seriously ill. Millions have died worldwide. 140,000 kids, according to a study just recently published, have, as of midsummer of this year, lost parents or a grandmother or grandfather who's a guardian to COVID. Imagine that. 140,000 kids have lost one or more parental figures. I mean, that's just horrifying. Um, and another disturbing item of information about the impact that the COVID pandemic has had is, according to a study released recently out of Oxford, published in the International Journal of Epidemiology, life expectancy has decreased dramatically in the 29 countries that they looked at, which included the United States, Chile, and 27 European countries. So for Western Europe, the decrease in life expectancy is the worst since the Second World War. For Eastern Europe, the decrease in life expectancy is the worst since the collapse of the Soviet Union in the late 80s, early 90s, where capitalism was restored, and basically they had a very sort of neoliberal, totally free market economy where Russia, for example, was opened up to being ravaged by foreign capital, and uh, life expectancy there declined by something like 10 or 15 years. Um, and fortunately, Russia hasn't been that traumatically impacted by COVID, but certainly there has been a severe impact. In the United States, the decrease in life expectancy that we've seen, which for men was 2.2 years and a little under 2 years for women, that's the worst that has been seen since records started being kept in 1933 in the midst of the Great Depression. So, in short, in terms of the impact that it's had on our lives, literally killing 740 some odd thousand people just in the United States, COVID-19 is the worst calamity to befall American society in the memory of just about anybody who's alive. I guess there are a handful of people who were little kids back when the last pandemic of this scale hit the United States, where 600 and some odd thousand people are estimated to have lost their lives in a country that was about half the size population wise of the U.S. So that was an even bigger tragedy, but this is certainly the worst one since then. And unlike back then, when there was no vaccine for the strain of influenza that was killing so many people, we have vaccines for COVID-19, but a lot of people are digging their heels in about getting them, and we have a vaccination rate of about 56%. And you don't hear too much about it, but every day hundreds of kids here in the United States are getting hospitalized with COVID. And you hear a lot of talk, unfortunately, from some sectors on the left, such as Glenn Greenwald, who did a so-called cost-benefit analysis of strict COVID mitigation policies a few weeks ago, where he kind of went out of his way to downplay the risks of COVID to kids and exaggerated the costs and downplayed the benefits of sort of zero COVID, very strict policies of countries like New Zealand and China, which have had very few deaths from COVID, and their economies have done pretty well and so forth. I talked about that in an episode a few weeks ago. And there are many others on the left who espouse these sorts of views. And I could go on all day about the various well-known people on the left who've jumped on the anti-vax or at least anti-vaccine mandate bandwagon. And never mind that we've had vaccine mandates in this country for really throughout our history. You have to get a whole slew of vaccinations in order to attend public school. You have to get vaccines to travel to certain places, etc. But and just a couple more things about COVID and kids. Record high 2,500 children were hospitalized with COVID-19 as were in the hospital on that date, September 10th. An average of 341 kids were being admitted to hospitals every day during September. More than 57,000 children have been hospitalized with COVID-19 since August 2020, according to the CDC. And again, that's just in the United States. A bit over 500 kids have died from COVID. That statistics changed some since then. I think it's about 600 now, which okay, that doesn't sound like very many people, right? 600 kids out of millions who have gotten COVID, but those are 600 kids who would still be here with us if it weren't for that. Kids aren't supposed to die, you know? Very few kids die. But hundreds of them have died from COVID. And, you know, more than 100,000 have had parents or grandparents, grandparents who were living with them and taking care of them, die from COVID. Um, Hundreds of thousands of kids have, you know, again, just in the United States, have developed long COVID, where you have serious, you know, debilitating symptoms for a period of, you know, many weeks or months after you're initially infected. Um, so, you know, even for kids, COVID's a big deal. Um, Another aspect of the impact that COVID has had on us is that it's been very disproportionate in terms of its impact on different ethnic groups and different socioeconomic strata. People such as Hispanic and Black Americans, Native Americans, you're more likely to work in frontline occupations such as factory workers, uh, other settings where you know, they're much more likely to be exposed to COVID, um, and you know, disproportionately more have died from it, um, or you know, been traumatized by it. Peter Hotez from Baylor University, Dr. Peter Hotez talked about how you know, the PTSD in the Hispanic community will last a generation. And one thing that you're probably aware of is that right now, kids under 12 in the United States and all but a handful of countries around the world are not able to be vaccinated yet, not eligible to be vaccinated. And you know, lo and behold, the demographic that has the highest rate of COVID infections right now is kids under 12. In the UK, where this article is reporting data from, I believe, yeah, very few kids between 12 and 17 are vaccinated either. The UK has, for some reason, got this idea in their head that you know, the government has gotten this idea in their head that COVID is relatively harmless among children, which you know it's not. And so the highest rate of COVID cases is school-aged kids who are going to school unvaccinated or largely unvaccinated in the 12 to 17 age group. And you know, real mitigation in UK schools. Very few have mask mandates. Their ventilation is very poor. Their classrooms are crowded. And so the rate of infections has skyrocketed in the UK, in spite of the fact that their rate of vaccination among adults is very high. Overall, they've got about a 66% vaccination rate, I think. But, you know, when you've got this population of completely or almost completely unvaccinated people, you cram together in a crowded, poorly ventilated space without masks, you're going to have an outbreak. And you know, even though their parents are largely vaccinated, you know, kids are bringing infections home to their parents, and you know, especially if they're unvaccinated. But even otherwise, you know, we know that there are breakthrough cases. So adults in the generation that's most likely to have school-aged kids in the UK are, you know, the second highest demographic in terms of infection rates. And you know, I've been giving you a bunch of statistics, but you know, when you look at the human beings behind those statistics, you know, it's just heartbreaking what you see. So this story's about a parent who whose 10-year-old daughter you know, died from COVID. And her daughter was you know, in perfect health. She had no comorbidities. anybody knew of, and although certainly it's more likely that you're gonna die from COVID or become seriously ill from COVID if you have comorbidities like obesity or heart disease or um, whatnot. That doesn't mean that you're immune to serious consequences if you don't have any uh, ongoing health problems. And so this poor woman, who's a school teacher in Virginia, lost her daughter to COVID, and you went to a school board meeting, having watched the meeting the previous week, where many of the parents were outraged about the idea about the fact that the school district had a mask mandate, and wasn't necessarily being very well enforced, which is kind of a big problem in many places. Here in Bloomington, Indiana, where I live, we have a mask mandate in the county, but a lot of people ignore it. We were just in the grocery store yesterday, and part of it I think was because the signage on the front of the store, Kroger's, was not very clear. It didn't say everybody has to wear a mask or that there was a countywide mask mandate. It basically said, well, if you're unvaccinated, wear a mask. If you're vaccinated, we encourage you to wear a mask. Which, I mean, that flies in the face of what the local regulations are. But in any case, so there, and I gather it's even worse in the UK, where almost nobody wears a mask these days, and that's probably a major reason why they have such a high rate of COVID cases, in spite of having a fairly high vaccination rate. But so this poor woman, Nicole Sperry, went to the school board meeting, talking about how parents were spreading misinformation, saying that COVID was basically over and healthy people don't die. And she said, while they were sharing this information, at the last school board meeting, I was sitting next to my healthy daughter's deathbed. She died 5 days after showing symptoms. I'm sure they were speaking to what they've experienced, but they're wrong. So many frontline workers have lost their lives. Here's a story about a flight attendant, a young man. Well, no, I guess he's not that young, 60, but didn't have any particular comorbidities, but was hospitalized and died with COVID, and there are many others who've lost their lives in that line of work. Here's a website that keeps track of healthcare workers who've lost their lives. In some states, medical personnel account for as many as 20% of known coronavirus cases. And let's see. This was back in 2020, even back then, August of 2020. Approximately 1,000 healthcare workers had lost their lives from COVID. And they talk about the stories of some of them. You can see, some of them are pretty young people. But I mean, if you're exposed to a high dose of, high viral load, you could get very, very sick, even if you are young and healthy. And of course, these people wear protective equipment on the job, but there have been a lot of cases where they haven't been able to get hold of good PPE, surgical masks instead of N95 masks, for example. and have gotten sick. So let's have a look at uh, one. 61. He looks a lot younger than that. Um, as a nurse in Ohio's prison system, Bernard uh, worked overtime so he could afford to ship uh, clothing and other things to um, his relatives overseas. Um, and his son um, encouraged him to quit his job as a nurse, worried about inadequate protective gear. And he said, "No, it's my duty." Um, but he got COVID, showed symptoms, but stayed home, didn't go to the hospital because he was afraid of the hospital bills. Which that's a big problem in the United States, where so many people are uninsured, um, and are racking up big hospital bills if they get COVID or, of course, any other serious illness, and being bankrupted as well as being very sick. And one study done a few months ago estimated that roughly a third of deaths from COVID, approximately 200,000 out of at that time 600,000, were attributable, at least in part, to people not having health insurance. And that's also a big problem with why we have so many people who are hesitant to get vaccinated in this country, is because since so many people don't have health insurance, they don't have a regular doctor that they see, so there's no medical professionals to give them good expert advice on vaccines or other things. So that's another big problem that we have. According to the World Health Organization, as of May of this year, at least 115,000 healthcare workers worldwide have died from COVID. Um, just bravely trying to save lives and get people well, and getting infected and sometimes losing their lives in the process. Other frontline workers who've been very hard hit are school teachers. So in one county, pretty small county population-wise in Florida, 16 teachers have died there just since the beginning of school this year. Meat packers and other workers who work in very crowded conditions at factory jobs have also uh, died or gotten sick at a high rate. Um, you may remember the story of Chris Malls, a Amazon warehouse worker in Staten Island, who was fired from his job by Amazon last year because he kind of blew the whistle on Amazon's lack of providing you know, sufficient protective equipment for workers, and just really not implementing any significant COVID precautions. Um, okay, so now that hopefully I've convinced you that this is a serious problem, I can now turn to the topic that is the focus of this segment. Um, the unfortunate comments by Jimmy Dore and Max Blumenthal, kind of downplaying maybe the impact of COVID and um, really centering their message around opposition to vaccine mandates, saying that this is sort of an unacceptable infringement on civil liberties, and in the process, really downplaying the efficacy of vaccines, and you know, the evidence suggests exaggerating the impact of vaccine mandates on people's employment situation, where they quit their jobs because they don't want to get a vaccine. And I should stress that I largely agree with Jimmy and Max politically. Um, Max is the founder of the Gray Zone, and provides excellent, insightful coverage on foreign policy. I rely on the Gray Zone a lot for information about those sorts of issues. Jimmy has very good political instincts. He's also very funny. He's um, led the way on pushing for Medicare for all with the Force the Vote initiative that he played a big role in spearheading, um, and he's called out a lot of the BS from so-called progressive Democrats like the Squad and Bernie Sanders and so forth. Um, so I think that Jimmy and Max and most other people on the left who take this sort of stance, either anti-vax or at least anti-vaccine mandate, um, and maybe not trusting vaccines very much. I think folks mean well, but I feel like um, there's some issues with sort of this libertarian ideology that seems to be very big among that segment of the American left, and kind of an insufficient understanding of science, and kind of really how capitalism works in some senses, and I'll elaborate as we go along. Um, but the thing that most immediately jumps out to me about this segment of the American left, as I've said in past episodes, is that they're really failing to grasp what an enormous tragedy this pandemic has been here in the U.S. and many other parts of the world, as I've just been talking about. So we had these enormous protests last summer about the police murders of George Floyd and many others. And people were right to be outraged. There should have been massive protests, but somehow the far greater number of deaths from COVID and all the disability and suffering and tragic loss that families have experienced, post-traumatic stress disorder on the part of frontline healthcare workers. There's just not the same sense of outrage about that. It doesn't seem like among this segment of the left. And you hear all this talk in segment after segment on Jimmy Dore's show about the mandates, and he's had anti-vax an anti-vax doctor on the show. It really doesn't talk about the fact that between 1,500 and 2,000 people are dying from COVID every day. 1,700 just yesterday. Just not much recognition of the magnitude of this tragedy that we're experiencing, let alone discussion of solutions. So today what I want to do is focus on a specific video, an interview that Jimmy did with Max Blumenthal, and go through some of the things they said, and raise questions about it, present evidence contrary to it. So let's watch some of this.
who've been retired, who may have had a license lapse, bring in people from elsewhere.
Retired. So we're going to bring in retired people, people whose licenses have lapsed. So we're literally going to put people out on the street. We're going to take away their livelihood. And that seems like a crazy number. Could this possibly be true? 70,000? Could that possibly be true, Max? Is that real?
It's absolutely true, and we've already seen the mandate.
I guess I should have introduced the segment here. They're talking about the vaccine mandate in New York's healthcare system, implemented by the governor of New York. And out of 450,000 workers in the New York healthcare system, at one point in mid-September, there were about 70,000 who had not gotten a shot for COVID out of those 450,000. And what they're trying to imply here is that all those people are going to refuse to get vaccinated and be fired as a result. And I don't know why they would assume that, but they do, and you really play up the impact on workers of this vaccine mandate policy. So let's continue.
Mandates prevent students from getting to school because of the amount of school bus drivers who are being fired. Now we see Kathy Hochul, Andrew Cuomo's replacement, literally waging war on the working class. She's bringing in the military to replace them, or threatening to do so. And 70,000, I mean, that's not an implausible number. There's no consideration for the cost on the public healthcare system here. I mean, not that we really have public healthcare, but it's not considered. The only thing that's considered is one thing, which is meeting these fantastical goals of vaccine uptake. The lives of these people, these workers, are not considered, whether they will go hungry in a tight job market. And this is the perfect method. This is the perfect mechanism for intimidating workers when you have such a tight job market. I spoke to a construction worker in Midtown New York yesterday. He actually approached me and he said that he felt intimidated into taking the jab. He feels like his constitutional rights are being violated, his bodily autonomy is being violated, but he did not want to go hungry going into the winter, and that many of his colleagues feel the same way. And I've heard this from people all across the spectrum in different fields. I just got off the phone with Garrett Ramirez, who is a 9th grade public school teacher in New York City, a member of the teachers union, very active member of the teachers union, and a leader of Teachers for Choice that has been fighting these mandates. And he told me that 20,000 Department of Education workers could be thrown out of work. There are currently about 36,000 who have not taken the jab, and that's the estimated number.
Okay, so actually the group that he's talking about, Teachers for Choice, is this sort of far right, not only anti-mandate but anti-vax group of teachers, and well, we can talk some other time about the political affiliation of really the majority of people who are opposed to vaccines. But what I want to focus on right now is just whether what Max and Jimmy are saying, that there's going to be tens of thousands of workers in New York being thrown out of work. If you look closely, at how employer mandates are playing out, that doesn't really seem to be happening. So, in Virginia, Innova Health Systems in Falls Church, Virginia, has about 20,000 workers, healthcare workers. and they had a vaccine mandate set for September 1st. 89 out of 20,000, so that's less than 0.5%. Quit their jobs. And same thing in Winchester, Virginia, a little higher number, about 300 out of, 72 out of 6,000 were terminated because they refused to get vaccinated, so a little over 1%. Rhode Island, as of October 2nd, 92 healthcare facilities in Rhode Island were unable to meet the state's deadline requirement that all employees be vaccinated. We're requesting a 30-day extension, but I said 98% of the workforce was vaccinated, fully vaccinated as of October 1st. And they were giving people until October 31st to receive their second shot. United Airlines. On August 6th, United became the first airline to tell its workers to get vaccinated against COVID-19 if they wanted to keep their jobs. And at this point, 99.5% of employees at United Airlines, other than those who applied for religious or medical exemptions, had been fully vaccinated. So in New Jersey, a similar mandate was implemented to that in New York, a little bit earlier, I guess. Their mandate was a little less strict than New York's. New York didn't allow frequent testing as an alternative for those who chose not to get vaccinated. But the vast majority of workers in New Jersey's 650,000 healthcare workers, got vaccinated. So very few are refusing to get vaccinated. A hospital system in I'm not sure where that is, somewhere in I don't know, Virtua Health System in New Jersey. The vaccination rate last week was 96%, up from 69% when the policy was announced July 30th. Okay. Same with University of Colorado. 119 people lost their jobs out of tens of thousands. Tyson Foods, who's where a lot of workers lost their lives, several dozen early in the pandemic. You have seen their vaccination rate increase from 50% to 80% as of a couple of weeks ago, and they have until November 1st to get vaccinated. So they're making amazing progress. As of a couple of weeks ago, the NBA reported having reached a 95% fully vaccinated rate among their players. Even holdouts like Andrew Wiggins of the Golden State Warriors did eventually agree to get vaccinated. The most prominent person who's still holding out is Kyrie Irving of the Brooklyn Nets, and we'll see what happens there. But he's definitely an exception to the rule. So this claim that 72,000 workers were on the verge of losing their jobs in New York, that Jimmy and Max were making, it's just not honest. The mandate in New York required for workers to have received one dose by the deadline at the end of September, and 92% of the 450,000 workers, had done so. So even if they had fired all the workers who were completely unvaccinated, which they didn't actually do, it would have been 36,000, not 72,000, and more have gotten vaccinated since then. United Airlines says it's received a big increase in job applications since enacting a vaccine mandate. So, imagine that. A lot of people like the idea of working in a safer workplace. And one thing that's really kind of rubbed me the wrong way about the way in which some sectors of the left, such as Fiorella from the Convo Couch and Jimmy and Max and so forth, is that they're really sort of using this play to identity politics to make their argument. So Fiorella Isabel says here, vaccine mandates create a two-tiered society directly targeting the already disempowered working class, including a large number of minorities, not to mention the obvious overreach from an already corrupt and roided out government. Again, who is it that's been, hit the hardest by COVID in the first place? It's people of color, black and Hispanic, and Native American people have the highest rates of death or severe illness from COVID of any ethnic group in the United States. If anything, they would disproportionately benefit from their workplaces mandating that people be vaccinated. They'll be safer. And this assumption that large numbers of people of color are going to quit their jobs rather than get vaccinated, that's not playing out that way. 95% of professional basketball players who are predominantly people of color have gotten vaccinated, and more will by the time their season starts. It doesn't look like there will be too many holdouts. And this notion that people who refuse to be vaccinated, who overlap with but aren't the same as the unvaccinated in general. About as many are just vaccine hesitant or have been putting it off, but are not hardcore anti-vaxxers. Most people who are unvaccinated are not. And this notion that poor people or people of color are going to be disproportionately impacted by vaccine mandates because they're the ones who are least likely to be vaccinated. That's wrong in a couple of respects. First of all, although it's been true that people of color, at least black and Hispanic people, are less likely to, are more likely to, kind of put off getting vaccinated, that doesn't mean that that's going to continue to be the case. So, looking at recent data on rates of vaccination, so over 7 in 10 adults overall now report being vaccinated for COVID-19. Well, how does that break down by ethnicity, you might ask. Well, the people who are most likely to be unvaccinated at this point are Republicans, rural residents, uninsured people. I talked about how people who are uninsured are less likely to, or tend not to have a regular doctor, so they don't have anybody to talk to about getting vaccinated. White evangelical Christians and young adults tend to be the ones who are vaccinated at lower rates. And if we look at the breakdown by ethnicity, let's see. White adults, 71% have been fully vaccinated or say they're going to get vaccinated. Excuse me, have one dose or say they're going to get it very soon. Compared to 70% of black adults, 71 versus 70. So this gigantic gap between black and white vaccination rates that people like Fiorella and also Jimmy and Max, who mentioned a statistic from a couple of months ago about vaccination rates specifically in New York City, where they said that only 28% of black adults in New York were fully vaccinated. Well, since that time, a couple of months ago, it's gone up to 42% fully vaccinated, roughly 50% partially vaccinated. And that's just one city. Again, if you look overall, polls indicate about 70% of black adults versus 71% of white adults, 73% of Hispanic adults, and I don't see the figures in this article, but here's an interesting statistic, if it will come up. Jesus, why does it do this? 98% of Blackfoot Indians are vaccinated, and the vaccination rate in general for Native Americans is the highest of any ethnic group in the United States, more than 80%. Asian Americans also have a very high vaccination rate, roughly 80%. And so this notion that it's people of color who are going to be disproportionately impacted by vaccine mandates, it turns out not to be true, because in fact, the people who are most likely to be hardcore opponents of getting vaccinated, people who are adamantly anti-vax, anti-mandate, of course, and also typically opposed to mask mandates or lockdowns. If you look at who is protesting these things, overwhelmingly, it's conservative, right-wing white people. In New York City, whereas up until now there's been a lag in the vaccination rate of black New York City residents, which is changing. The hardcore anti-vaxxers are right-wing white people, overwhelmingly. It's just not even close as to who the demographic is that's really pushing against vaccines in this country. Just recently in Los Angeles and elsewhere on the West Coast, there were anti-vax protests by the Proud Boys, not exactly a liberal group. And it's been the same in other countries. In France, for example, the far right has been leading the charge against vaccines and now against vaccine mandates in France. Let's see, what was I going to do here?
In the Caribbean region who feel that way. Many people might not feel that way, but she's clearly speaking for a constituency. She's speaking for a constituency that she knows. And her message resonated, and she was such a threat that the White House tried to rein her in. And now
He's talking about Nicki Minaj there, the black pop star.
You see this happening in the NBA with Kyrie Irving, Jonathan Isaac on the Orlando Magic. And I was watching Chris Hayes last night on MSNBC, and it was a disgusting segment where Chris Hayes was painting these players as stupid and suggestible conspiracy theorists and claiming that they believe that the Moderna vaccine contains a microchip and that they don't want to get this microchip in them. And then he brings on an NBA player, but not a black NBA player, to denounce these players, an NBA player from Turkey, Enes Kanter, who happens to belong to the Gulenist cult, to basically denounce these guys and call them stupid conspiracists. And then we see Jonathan Isaac of the Magic asked about why he's taking the position he's taking. And he sounds far more insightful and articulate than the CDC director and far more humane. And he said, well, I've already been infected previously. I have natural immunity. I have stronger protection than the players who've been vaccinated. And we need to stop this insanity of claiming that I'm a threat to other players, particularly when the vaccine does not prevent infection in all cases and therefore does not prevent viral transmission. It's an individual choice. So you see, he's actually, you know, when you push people out with mandates, you're often pushing out the critical thinkers.
That's right.
You're pushing out the people that think for themselves. You're pushing out the people that care about their rights. And so in many ways, we could witness a kind of brain drain. With what was happening here is these people who are willing to take this stand, who won't be vaccinated and are willing to lose their jobs. Well, what else can you do to convince them? If this is to convince people to get vaccinated, what else can you do if they're willing to lose their jobs? Nothing. And so these people have been moved into the classification of surplus humanity, and they will be isolated.
Sorry, I couldn't stop it here. Yeah, so again, you know, exaggerating the number of people who fall into this category of being so adamant in their position against getting vaccinated that they're willing to lose their jobs over it. And, you know, I guess I don't really have time to show this other segment. That Jimmy did, specifically on that NBA player, Jonathan Isaac, who is refusing to get vaccinated, supposedly based on science. You know, the claim that people who've had COVID before are less likely to get reinfected than people who are vaccinated are to get, you know, have a breakthrough infection. And you know, I guess I don't really have time to play it, but I just found, I'll put a link to the video in here, but I just found it very, annoying how Jimmy was really kind of, playing up, oh, this articulate black man, as if that's some sort of novelty or something, that's speaking out so eloquently and in such an educated way about why he shouldn't have to get vaccinated since he's had COVID before. Again, with the identity politics. I mean, if we're going to play that game, Jimmy, why is it that you don't consider the opinions of another eloquent black man, the elder statesman of the NBA, Kareem Abdul-Jabbar, who recently wrote a column, appeared in Jacobin and as well as on his own blog, about Kyrie Irving's refusal to get vaccinated and what he felt was the misguided support that he received from some other prominent NBA players. So, it's worth taking a look at what Kareem said here. It was very persuasive, I thought. So he says, I'm a huge fan of LeBron James, both as one of the greatest basketball players ever and as a humanitarian who cares about social injustice. I've written his praises many times in the past and undoubtedly will in the future. I admire him and have affection for him, but this time LeBron is just plain wrong. And his being wrong could be deadly, especially for the black community. After the Golden State Warriors' Andrew Wiggins received criticism for refusing to get the COVID-19 vaccine for personal reasons, his teammate Draymond Green said the public needs to honor that decision, quote unquote. There's something to be said for people's concerns about something that's being pressed so hard, he stated. Why are you pressing this so hard? You have to honor people's feelings and their own personal beliefs. To which LeBron responded that he couldn't have said it better myself. And Kareem said, actually, it couldn't have been said worse. Wiggins has since received a vaccine, though he made clear that it was under financial duress because he wouldn't have been able to earn a living as a professional basketball player unless he got vaccinated. Other than vague claims about freedom, he's never offered rational support for his stance. Neither has Brooklyn Nets guard Kyrie Irving, who continues to reject the expertise of prominent immunologists without reason, contributing to vaccine hesitancy among people in the black community who are dying at twice the rate of white people. His lack of regard for black lives doesn't deserve acceptance, nor does his lack of regard for the health and welfare of the NBA community. So, what Kareem is saying here is, these players are, they're celebrities, they're role models to an extent. They're people who, people in sports fans in general, but definitely people in the black community, if they're black, listen to. And so, not only is Kyrie Irving refusing to get vaccinated himself, but he might convince other people to not get vaccinated, and so it's potentially harmful in that sense. On the surface, it appears that Draymond and LeBron are arguing for the American ideal of individual freedom of choice, but they offer no arguments in support of it, nor do they define the limits of when one person's freedom is harmful to the community. They are merely shouting, I'm for freedom. We're all for freedom, but not at the expense of others or if it damages a country. That's why we mandate seatbelts, motorcycle helmets, car insurance, and education for our children. For example, seatbelt compliance is at 88% in the United States, but that 12% that doesn't comply results in 47% of car accident fatalities, 17,000, and costs U.S. employers $5 billion a year, and those costs are passed on to us. And of course, we could add to that, that we have laws against drunk driving, and an even larger percentage of people die or cause other people to die as a result of driving drunk. So, should we give people a choice to drive drunk? I don't think so. The cost of COVID-19 for this country is difficult to measure. We can come up with a monetary amount. Harvard economists say it's cost us $16 trillion so far, money that might have been spent to build the country, provide jobs, or help the disadvantaged. But the real cost is 700,000 lives, thousands of which could have been saved if they'd followed Centers for Disease Control and Prevention protocols and gotten vaccinated. And thousands more are dying every day. Add to that the medical costs of those who will suffer for years from long-haul COVID symptoms. Oh, he goes. He brings up drunk driving here. The passion of those urging vaccines might suggest that there's some urgency to their opinion, that the situation is serious and we need to take immediate action to protect people, that thousands are dying every day, mostly among the unvaccinated, that people in the black community where vaccine hesitancy is high are dying at a disproportionately higher rate than white people, that publicly talk about honoring opinions that contribute to death is irresponsible. The country also mandates against drunk driving, pressing hard, as Draymond Green said about push to get vaccinated, against the freedom to drive under the influence. We do that because drunk driving kills 11,000 Americans every year and costs us more than $44 billion. 11,000 is slightly less than 17,000 that die from not wearing their seatbelt. Vaccine deniers and those who want to honor them, quote unquote, are like drunk drivers who are convinced they're okay to drive. When they make it home without an accident, that means they were right, until they aren't, which is why 97% of COVID deaths are among the unvaccinated. And while some who don't get the vaccine might never get sick, or if they do suffer mild symptoms, they are still potentially spreading the disease to others, killing some. While we're honoring the unvaccinated, COVID cases are rising alarmingly among young children. I think of a situation like those old fire brigades when people stood in a line passing buckets of water to save their neighbor's house from burning to the ground. Maybe some people were afraid to join the line, but when the town leaders joined in, it encouraged others to do their duty. Today's celebrities and athletes are like those town leaders. You either join the line to save your neighbor's home, or you stand by and let it burn because you don't owe them anything. Okay, I thought that was a powerful statement by Kareem. So, this very sort of narrow focus on the rights of the vaccine refusers that Jimmy and Max and a number of other leftist Americans adopt. Literally Libertarian Party sort of ideology. Just totally focus on these poor workers, supposedly disproportionately people of color and poor people, who refuse under any circumstances to get vaccinated, even if they will lose their job if they don't. They're treated as if they're this new oppressed group. Supposedly disproportionately people of color and poor people, even though the hardcore refuseniks are not disproportionately people of color or poor people, but are disproportionately white Republicans. And they're treated as the most important oppressed group to protect, to protect their precious civil liberties. When all along, they have a choice to get vaccinated or to find some other way to earn a living, perhaps, if they're that adamant. So because they have a choice, they're not an inherently oppressed group. You don't have a choice if you're black. You just are. You don't have a choice of whether or not to be a woman or gay or whatnot. You do have a choice about whether or not to get vaccinated. So to treat unvaccinated people as this oppressed group, I'm sorry, that's just bullshit. And to focus exclusively on those people and not give any consideration or focus to their coworkers who would rather have a safer workplace, Not that vaccinated people can't get infected and spread it to others, but they're a lot less likely to, as we'll talk about in detail in a few minutes. In the case of healthcare workers, where's the consideration to patients who, in many cases, have no choice but to come in for medical care? And what if the reason they're there isn't because they're infected with COVID? Or they might be put at risk of developing that additional health problem by unvaccinated workers. So one thing I have to ask Jimmy and Max and other people on the left who take this perspective is, you talk about those poor oppressed workers who are going to have to get vaccinated or lose their jobs. Does being vaccinated make you not a worker? Come on. Everybody's a worker. Well, not necessarily everybody is part of the working class. Some are part of the ruling elite, but the vast majority of us are, workers, and have rights as such, regardless of whether or not we're vaccinated. But if we're unvaccinated, I don't think we have the right to put other people at risk by putting ourselves in situations where, since we have a higher probability of getting infected if we're not vaccinated, we could be putting other people at increased risk. Just one other segment I wanted to show you. Oh, shoot. So, another thing that's kind of problematic about how Jimmy and Max approach this issue is they have this notion that they know better than other people who actually have training and expertise in the relevant areas of science. And so, for example, they are very sure of themselves in insisting that Jonathan Isaac is right, that if you have had COVID before, you have stronger immunity than somebody who's vaccinated. They frequently claim the vaccines aren't very effective in preventing infection.
Public, then there's nothing you can do about that. You cannot force someone to take a vaccine. That's Fauci, August 2020.
Sorry, it's a little later. Fuck, why is it doing this?
These vaccine mandates are not about health. That's not about health. Go ahead, Max.
It's really confusing when you consider where this is going, because they want to get to some kind of herd immunity or some kind of threshold of vaccination upwards of 80%. But then when you look at Harvard Business School and what just took place there, where the school is 100% vaccinated and has mask
No, it's
mandates.
not, Max. No, it's not.
And they have just gone to remote learning. They've ended in-person learning for the time being.
Uh, there was no figure given for the percentage of people vaccinated in Harvard's business school in any of the press reports I've read about. So the overall rate for Harvard University was, I think, in the high 90s in percentage of people vaccinated, but they didn't give a figure for Harvard Business School.
Because of an outbreak of COVID cases. And you've seen new restrictions on other campuses.
Duke University, same thing. Duke University, they had like 99% vaccination rate. They had an outbreak. Go ahead.
Yep. 380 cases.
380 cases out of 15,000 students. And none of them went to a hospital, not even a single one.
Over 90% of them were in the fully vaccinated. Because you're talking about cases in the PCR test. And I'm not going to argue with people who say that, the vaccines prevent, help limit death in many groups. I'm not sure if, young people who are completely healthy would necessarily die from COVID, but, they've gone and taken it and they're still having cases. And on a population.
Well, as I talked about earlier, Max, young people do die from COVID, even children, who are the least vulnerable of all groups. Several hundred have died, and it's in the thousands for people between like 18 and 30. So it's not harmless to young people by any stretch of the imagination, and that's just deaths. We're not talking about long COVID or getting ill enough to wind up in the hospital. And of course they can infect other people. So, a very wrong-headed take here.
Level, the vaccine is not preventing cases, many of which are just like asymptomatic or mild infections where they get, the sniffles or they cough for a few days. Maybe there aren't that many hospitalizations, but the ruling class of our country, which shifts in and out of, university positions, either as faculty or directors of the university. You look at like Judith Rodin, for example, former University of Pennsylvania dean. Now she's the head of the Rockefeller Foundation, which is guiding a lot of the so-called science right now. They've determined that classes have to be shut down.
Jesus, stop. Okay, so what I wanted to highlight there was his claim, which he's made elsewhere, that although they prevented hospitalizations and deaths, the vaccines are not preventing infections. That is just not accurate. Nobody's ever said that vaccines would 100% eliminate people getting infected with COVID. The clinical trials showed, depending on the vaccine, somewhere between 70 and 95% reduction in likelihood of getting COVID for those who were vaccinated, 94 and 95% respectively for Moderna and Pfizer. And their real world performance has been fairly similar to that. And also the claim that Jimmy and Max have made that people who have gotten COVID before are more protected from future infection than people who have gotten vaccinated. The evidence is more mixed on that perhaps than on the efficacy of vaccines, but preponderance of research on that suggests that in fact being vaccinated provides stronger protection than so-called natural immunity, which, that's a misnomer, which unfortunately some people in the medical community use, but here's Max again on a Twitter post claiming that there's no medical or scientific reason for vaccine mandates because vaccines can't prevent infection. which, that's just nonsense. But let me just quickly show you some data. One of many studies on comparing COVID reinfections, people who've been previously infected, with breakthrough cases among people who are vaccinated. And basically, the findings of this study, data from the Oklahoma Department of Health, are that people who've been previously infected but have not gotten vaccinated are anywhere from 2 to 9.5 times as likely to get infected with COVID, reinfected in their case, as people who've been vaccinated. And people who are in the anti-vax community, or who are opposed to vaccine mandates, like to play up a study from Israel that didn't find that, but and found that people who were previously infected were less likely to subsequently get infected again than people who were vaccinated were to be infected. And I don't have time to go in much depth on this, but I will. Oh shoot! I meant to show you. Yeah, there's a study I was trying to show you. Sorry about that. But I wanted to link a video for you that goes into more depth some of the problems with the study from Israel. And basically, the main point that this guy makes. Shoot, what's going on here? I don't know what the problem is here that I can't get it to play. But anyway, the main point that he makes is that in this study, the people who were vaccinated were overwhelmingly elderly people, because the study started with people who were vaccinated in January and February in Israel, where at that point in time, the people who were getting vaccinated were overwhelmingly elderly people. And compared to the natural immunity group in that study, the group that had previously gotten COVID, they had more health comorbidities, just more risk factors, and thus were more vulnerable to breakthrough infections than people who were previously infected. The group of people they sampled who were previously infected were to have a reinfection, and another thing that we have to keep in mind is that people who get infected with COVID sometimes die from it. And in fact, between the time that they started the study and the summer when they finished collecting the data, there were several hundred people who died, or I guess it was 1,500. And most of these people, overwhelmingly, these people were unvaccinated people, because you're even if you're older, something like 90% less likely to die from COVID if you're vaccinated. So that really screws up your sample. It biases your sample. Well, what statisticians call a survivor bias is a really big issue with this study. And so you're comparing apples and oranges there. And this isn't an issue that we have, that scientists have resolved as of yet as to whether previous infection or vaccination provides stronger protection against future infection. But most of the studies suggest that being vaccinated provides stronger and more lasting immunity. And also, all of them who have looked at this have found that if you've been previously infected with COVID, you might for a time have some immunity, although you're not guaranteed of developing immunity. For example, if you have a mild infection, you're not going to produce very many antibodies to start with, and they're going to go away quickly. So, previous infection doesn't necessarily help you. It just depends on how many antibodies you produce as a result of getting infected. And, also, you're a lot better off if you've had COVID before getting vaccinated and having that additional boost than if you're not vaccinated. Some studies suggest more than twice or less than half as likely to be reinfected if you've been infected before and gotten vaccinated than if you've been infected before and don't get vaccinated. So Jonathan Isaac from the NBA, this player who is making this big deal out of his natural immunity, so to speak, to COVID from having been previously infected, he's ignoring that his immunity would be stronger if he went ahead and got vaccinated. Okay, so that's one respect in which Max and Jimmy are just way off base on the science here. And the other aspect of that is that Max and Jimmy dispute the efficacy of the vaccines in preventing infection. And on a recent show, which I guess it was a live stream and they haven't published the segment as a replay, Jimmy talked about a study where they looked at 68 countries, their vaccination rates and their case rates, and found that there was no relationship. And Jimmy cited this as if to say, well, hey, look, vaccines aren't doing all that much to prevent infection because there's not a big or not a statistically significant difference in infection rates as a result of vaccination. The problem with a study like that is when you compare different countries, there are so many variables that influence the prevalence of COVID in the community besides vaccination rate. That even if there is an effect, which as I'll show you in a minute, there is, that can get washed out by things like whether or not a country locked down sufficiently to eliminate or drastically reduce COVID cases. Whether a country has mask mandates and how strictly those are followed. As I told you earlier, we have a mandate here in the county that I live in. People don't necessarily abide by it. I went into the laundromat the other day and hardly anybody was wearing a mask, even though there's a sign right on the door that says, countywide mask mandate, please wear a mask, it's required. If a country has been hit very recently, like India was, with a huge outbreak of COVID, well, in that case, they do have a lot of natural immunity. So even though they don't have a high vaccination rate, they still have immunity from the natural, I keep using that term natural immunity, and I don't want to, because being vaccinated makes your immune system work better. So, that's a natural immunity too. But anyway, the reason why India doesn't have many cases right now, despite having vaccination rate currently is only about 20% partially vaccinated, 50% fully vaccinated. Is it that, they had this gigantic outbreak of the Delta variant of COVID? That's where the Delta variant originated. And, it's estimated that it killed millions of people. So, obviously, they don't have to worry about having immunity from COVID anymore because they're dead. But, among the people that survived, several million, tens of millions of people got infected, undoubtedly, if not hundreds of millions. So that may be a reason why India is not having very many COVID cases right now. And you see this pattern over and over again over the course of pandemics where the rate of infection goes up dramatically and then it reaches a peak and goes down, even in the absence of measures to mitigate it, which obviously will result in more deaths if you don't do anything to mitigate it. But even if you don't, it may keep going up for a long time, but eventually the rates of infection will come back down as a result of so many people being infected. Anyway, in closing, I just want to go over some of the evidence about how vaccines do, in fact, limit the spread of COVID. They don't, they're not foolproof. No vaccine 100% guarantees that you won't get infected with a disease that it's against. Maybe if you get like 2 boosters with some vaccines against some diseases, you're close to 100%. But generally speaking, no. Vaccines are not foolproof. You can get infected. However, it's a lot less likely that you'll get infected. And if you do get infected, that you'll transmit it to other people if you're vaccinated than if you're not. So let's look at some of the evidence from this. First of all, I looked up some data on different states in the U.S., their rates of COVID cases per 100,000 on several different dates over the course of the summer, and their vaccination rates, and looked at the 10 most vaccinated states versus the 10 least vaccinated states, and compared them. And as you can see here, for all these states from June 28th through September 15th, states with low vaccination rates, approximately 20-25% lower vaccination rate, had 2 to 4 times the number of COVID cases per 100,000. I think it was average per day per 100,000, than the 10 states with the highest vaccination rates. So, you can go down the list there, and it's always, at least twice, if not 3 or 4 times, the rate of the states with high vaccination rates. You can do the same thing with countries. Look at very highly vaccinated countries, the ones with maybe there's a little less than 20 with vaccination rates above 70%. By the way, Israel is not one of them, contrary to what a lot of people believe. Compare them with countries that have rates below about 50-55%, and you will find a difference, roughly a 2-to-1 difference in infection rates, which is not as big as a difference you find across U.S. states, but like I said, there's so many different things that vary between countries. So really, you're better off, instead of comparing regions with differences in vaccination rates, you're better off in finding out what's really going on with the efficacy of vaccines, comparing vaccinated people to unvaccinated people. So, of course, they did that with the clinical trials, as I was saying. found roughly 90 to 95% lower infection rates for some of the vaccines, 70 to 80% less for some of the others like AstraZeneca and Johnson & Johnson. But these studies, except for I think Cuba's clinical trial, they took place before the Delta variant became prevalent. So we have to turn to data collected in without randomly assigning people to be vaccinated or unvaccinated. So more sort of observational studies. You're looking at how vaccinated versus unvaccinated people fare, and the results are astonishingly consistent. So Malaysia, full vaccination reduces the risk of infection by 88%, symptomatic disease by 86%, hospitalization and death by well over 90%. Denmark, same thing. Vaccination reduces rates of infection by Delta variant by 85 to 88%, and reduces rates of hospitalization by 94 to 100%. I guess there weren't that many people in Denmark vaccinated with Moderna, so if you don't have that many people getting infected, I guess it's certainly possible that 100% of the vaccinated people stay out of the hospital. Germany, same thing. Vaccine efficacy against infection, 85%, against hospitalization, 96%, against ICU admission, 97% lower rate in the vaccinated, and against death, 100%. Seattle, Washington, same pattern. Vaccinated people unvaccinated people 7 times more likely to test positive for COVID, 49 times more likely to be hospitalized, 32 times more likely to die. Netherlands, efficacy against hospitalization and ICU admission above 95%. And importantly, even after 4 months, vaccine efficacy was high in all age groups. England, efficacy against infection, 85%, 85% lower rate of COVID infection in vaccinated people, 95% lower rate of severe disease, hospitalization, and death. Alberta, Canada, similar results. Italy, similar results. Ontario, Canada, same pattern, mid-80s for efficacy against infection with Delta, midnight or upper 90s for efficacy against hospitalization and ICU admission. Cuba, China, and Russia have all had clinical trials where they found that the vaccines that those countries produced were very effective in reducing the rate of infection. Other studies here in Indiana, where I am, overwhelmingly, people who were hospitalized or died were unvaccinated people. Same thing in Los Angeles. 20 times more likely to be hospitalized if you're unvaccinated, 5 times more likely to be infected. And also there's a lot of evidence that we have about vaccinated people who have breakthrough infections and their likelihood of infecting others. Now, you've heard a lot, perhaps, about the CDC study that found that vaccinated and unvaccinated people had a roughly similar viral loads. Viral load being the amount of the amount of virus that appears to be present as a result of the number of times you have to cycle the sample of stuff from your nose in order to get a positive test result. That's an indirect measure of viral load. But in the Netherlands, what they did was they took a viral culture and actually looked at, for example, whether the viruses taken in the sample were alive or not, and found that there was less infectious virus in the samples from vaccinated people, and that even though people with breakthrough infections had similar peak viral loads to those of unvaccinated people, they were sick for less time, so their viral loads decreased much faster in vaccinated individuals, and they were less infectious to begin with. University of Illinois, similar results. Vaccinated individuals with breakthrough infections are less infectious for a shorter period of time than unvaccinated people. Similar results from a study in London. And many other efficacy studies. Study of household contacts of people who were vaccinated and had breakthrough infections. They were less likely to infect their family members or other fellow household residents than unvaccinated infected people. And so just a ton of research here that shows that vaccinations, although certainly far from foolproof, are extremely effective at reducing the likelihood of infection, hospitalization, death, etc., as well as, if you do get infected, the likelihood of transmission. So in short, I just want to say that this notion that vaccines are not effective in reducing the rate of infection or reducing contagiousness in those who do get infected, or that vaccines are demonstrably less effective at preventing infection than having had a previous infection is at preventing infection. Like Jimmy and Max's contentions in that regard are based on just a lack of knowledge or understanding of the relevant science. And I think also there's among, not necessarily Jimmy or Max per se, but among a lot of people who take that sort of perspective where they don't trust the vaccines. It's understandable that people are a little leery of anything produced by big American corporations, but this idea that big pharma is this supervillain whose products are inherently untrustworthy, it reflects a simplistic understanding of how capitalism works. Because it overlooks that there's strong financial incentives for capitalist firms to produce products that work well. They make a lot of money if they produce good vaccines. Especially when the government guarantees their profits. But, Merck tried to produce a vaccine. It didn't work. So, the government's guarantee of their profits did them no good. They didn't make any money off of vaccines. They're hoping to make money off of a medication for treatment that seems to be working pretty well in clinical trials. And contrary to popular belief is nothing like ivermectin in terms of its chemical composition and whatnot. But anyway, Pfizer, Moderna, etc., have strong financial incentives to produce vaccines that work well. And there's also just sheer self-preservation at play here. We can all get infected with COVID and have serious disease and potentially die. There's nobody, no matter how rich you are or how big of a capitalist overlord you are, there's nobody who's invulnerable to COVID or other diseases. They wanted to protect themselves, obviously. And it wasn't the CEOs who produced the vaccines or tested them anyway. It was scientists. So, what's the real scandal with vaccines? It's not the effectiveness of the vaccines. Overwhelmingly, scientific evidence suggests they're effective and that they're very safe for the vast majority of people. The scandal is that these big pharma companies are trying to make money hand over fist by charging an arm and a leg, to mix metaphors together a bit here, to poorer countries in the world to get access to the vaccine technology. Like, they won't give up their patent rights, and so that's preventing a lot of countries in the world from getting access to sufficient quantities of the vaccine to vaccinate their populace. And that greed could come back to haunt us. And so that's really the scandal about all this. And I just want to close by saying, I don't think being opposed to vaccines, or even just opposed to vaccine mandates, is any sort of leftist or progressive position. It's not taking into account the fact that we have a public health crisis, a public health emergency, where almost 750,000 people have died and tens of millions have gotten seriously ill, and we need to stop it. And those figures are just for the United States, of course. So all these folks who on the left who are taking this position, this extreme libertarian position, you're not standing for social justice. You're not standing up for the rights of minorities. You're not doing any of that. You're simply standing in the way of a public health measure that could save, and already has saved, many, many lives. And a public health measure, in fact, that we've had in this country for more than 100 years, requiring people to get vaccinated in certain contexts, whether it be school or, in the midst of a pandemic, the workplace. If we really care about each other, we should care about doing everything we can to save lives, including requiring people to get vaccinated in certain contexts. And, on the other hand, there are many people on the left, people like Rania Khalek and Eugene Puryear, Katie Halper, the World Socialist website, Graham Elwood, who have been very supportive of the vaccines, and you think everybody should get vaccinated, and I think that's great. More power to them. And that's all I have to say this time. I went on for a long time here, so I will stop for now, and I will see you next time.